define at Healing Springs, in our philosophy, we broaden the definition of addiction. And addiction is a pervasive pattern of avoiding feelings.
Maybe there's a need for those behaviors. Maybe there's something that would make sense. Instead of just saying these behaviors are bad, they're unhealthy, we need to stop these behaviors, to kind of reframing these behaviors as something positive.
Is the part of your brain that experiences physical pain is the same part that experiences emotional pain.
And I know from my experience, it's the pain and trauma. And the more and more that this field has grown, they're recognizing that substance use or substance abuse doesn't happen by accident. There's a reason behind that. There's a purpose for people taking things that they know they shouldn't be taking, or doing things they know they shouldn't be doing. And the purpose is to manage pain. One thing that was always difficult for me was when I would work with people that had substance abuse issues, they would go to substance abuse facilities, like residential facilities, and they would address the behavior, but they never really addressed what was causing the behavior, the underlying purpose of the behavior.
Addiction. We are licensed as a substance use disorder facility. So we have primary diagnosis of drug or alcohol, but everybody that struggles with chronic addictions has all these other areas. And if you're not careful, you'll stop drinking, but you'll start smoking 2 packs of cigarettes a day, or you'll stop drinking. And the reason it goes from just using it as experimentation or using it as the doctor prescribes, the reason it goes from that into a major chronic addiction is because that substance or that behavior, if we're referring to cutting, actually is numbing emotional pain.
About 2 decades, about 20 years ago, they started talking about trauma-informed. So they started recognizing, okay, wait a minute, maybe there's a connection between mental health symptoms and diagnoses and some unresolved trauma. Because
experiences, the name of the game is, what happens is if you don't know how to deal with your feelings, you stuff them. And you stuff and you stuff and you stuff. And if you suppress and stuff your feelings down long enough, an interesting thing happens. It's almost like your head and your body kind of separate, and you shove all that down into your body, and there's like this kind of like a dam that gets built across your neck where head and body are connected.
Beauty and life can still be beautiful even in the dark times. So learning perspective, shifting your perspective from thinking you have to have everything perfect, and if you're not feeling good, you're doing something abnormal. That's a dangerous place to be.
So many people say, I know I shouldn't do these things, but why can't I stop? And so it's like their body has a mind of its own. And so what John's talking about is trying to get the head and the heart connected again.
A psychiatrist named Dr. Colin Ross, I worked with him for about 25 years.
Okay.
And our specialty was focusing on adult survivors of childhood trauma. And so I've had a lot of experience. And when you delve into the world of adult survivors of trauma, you're going to see every psychiatric diagnosis, every addiction under the sun.